What is arthritis? That's a big question because everybody that comes in here goes, I think it's just arthritis. I think it's just Uncle Arthur came to visit me. I think. Okay. Arthritis is actually just the breakdown of the joint. It's a generic term. We call it joint pain. But what is it really? Well, our body's a big giant machine. And so take this knee, for example. A knee, an elbow, a back, it doesn't matter. But what you're dealing with are hard bones and soft tissue between them. That soft tissue acts as a shock absorber, a cushion, a lubricator. It's a pivot point. If this wasn't here, boy, you'd be bone on bone and you couldn't bend or straighten your leg. But when this area becomes damaged, just like every other part of your body, it starts to form scar tissue. If you've ever gotten a cut on your hand, your body replaces that damaged tissue with stronger tissue, and we call it a scar or scar tissue. Since we're dealing with bones, that scar tissue shows up as bone spurs, calcium deposits, cartilage loss. And so arthritis itself is a generic term that's going to talk about joint pain. But there's a lot of different things that could be going wrong here, and figuring out what is wrong is how you figure out what the best treatment option is going to be.
Enjoying this video so far? Subscribe now and click notifications to be alerted when our next video drops.
Patients come in here and they say, well, I was diagnosed with arthritis. Okay, how? Did they take an x-ray? Did they do some orthopedic tests? Did they do anything? No, I told them my joints hurt. They said, well, you're getting old, it's probably arthritis. So what is arthritis? Well, anytime your body's injured, it tries to replace those injured tissues with scar tissue. And so when you're dealing with bones, whether it be your knee, your elbow, your shoulder, your back, your neck, whatever, a joint's a joint. Unless you're Willie Nelson, that's a whole different joint. But your bones are hard, the disc is soft. Or your bones are hard and the joint is soft. The cartilage, the ligaments, the tendons, they're soft. So in regards to the spine, I'll use this one because it's the easiest. This is hard, this is soft. That's normal. This acts as a shock absorber. It's also a pivot point. It allows you to bend, twist, turn. And then of course it's also a spacer that lets those nerves get out, and those nerves go everywhere. So your whole body is controlled by this nervous system that is constantly sending and receiving electrical impulses. When this becomes damaged, whether due to an old accident or what I call repetitive microtrauma, so if you sit at a computer desk all day long, you squish that soft tissue between the hard tissue like a marshmallow between graham crackers, causing it to bulge out. It doesn't take much, but that little bit of irritation sends a signal to the brain that the brain is, hey, I'm injured, come fix me. And so that scar tissue, which we refer to as arthritis, shows up as a bone spur or a calcium deposit. And because of that, it actually starts to make these little holes even smaller. If you've ever been diagnosed with spinal stenosis, that's what that is. That hole's getting smaller due to the buildup of arthritis or scar tissue around it. And then, of course, after years and years and years of neglect, the bones will literally grow themselves together. This is fused. So, saying you have arthritis really doesn't mean anything. What you have to know is what stage of arthritis, because if you're in this stage, there's a really good chance you can go back here. If you're in this stage, we just want to make sure you don't get here. And so, at our office, we'll identify and figure out which phase that you're in, or stage, depending on which orthopedic scale you're using, and then come up with a treatment plan. Now, the one thing that I can promise you is that basic anatomy and physiology does not change for most of us. Obviously, there are exceptions to that rule, but we know that motion is lotion. If you don't move it, you lose it. You'll hear me say that all the time. So a lot of the things that we teach our patients to do is how to move their joints so that they can stop the progression of arthritis. Because again, the one thing all doctors will agree upon is that arthritis gets worse the longer you have the damage. But it's not age related. You could be 80 years old and look like this, or he could be 30 years old and look like that.